Hi, my name is Dr. John Houle, and I'm going to speak to you today about breast reconstruction. I'll talk about the options for the timing of breast reconstruction and about the various techniques that can be used. My goal is to provide you with the pros and cons of the major types of reconstruction to help you make the best possible decision before deciding which option might be right for you. Breast reconstruction can be done at the same time as the mastectomy, which is called immediate reconstruction, or later after you have had your mastectomy, which would be called delayed reconstruction. The main advantage of immediate reconstruction is that it lets you combine procedures. Because you are combining procedures, you avoid 2 recovery periods, 2 separate times off of work, etc. Immediate reconstruction can also mean you might be able to have what's called a skin-sparing mastectomy. This is a type of mastectomy that leaves more of your own breast skin intact and can result in a nicer outcome after reconstruction. Delayed reconstruction is performed anytime radiation is planned or if a patient chooses not to have reconstruction initially. All of the different types of reconstruction can be performed on an immediate or a delayed basis. The types of reconstruction can be broken down into 2 main categories: those that use an implant, which is called implant-based reconstruction, and those that use the patient's own tissue, which is called autogenous tissue reconstruction. Implant-based reconstruction is a staged process. During the first surgery, a temporary implant called a tissue expander is placed in the breast, underneath the skin and one of the muscles in the chest. At this time, the tissue expander is filled part way with saline solution and the incision is closed. The incision is allowed to heal for a few weeks, at which time the patient begins the tissue expansion process. This expansion stretches the skin and muscle gradually to make room for the permanent implant, which will eventually give the breast its size and shape. Tissue expansion is performed in the clinic and consists of injections of saline solution into the tissue expander. These injections are usually done weekly for 4 or 6 weeks. After the skin is stretched, it is allowed to relax for 2 or 3 months, and then a second surgery is performed to insert the permanent breast implant. The permanent implant can be filled with either saline solution or silicone. Your surgeon could discuss the advantages of both types of implants with you. The main advantage of implant-based reconstruction is that it's the easiest type of reconstruction. The initial surgery keeps the patient in the hospital 1 to 2 nights, and since tissue isn't taken from any place else on the body, all of the scarring and pain is confined to the chest. Less time off of work would likely be required with this surgery than with autogenous tissue reconstruction. Additionally, a patient can essentially be reconstructed to any size with this method. As the tissue expander is being filled, we can stop whenever the desired size is reached. There are limitations with implant-based reconstruction, however. One is that an implant reconstructed breast does not look as natural as when autogenous tissue is used. This is a definite consideration when reconstruction is performed on only one side, as the symmetry between natural and reconstructed breasts might be limited. Another issue is that implants can leak and need to be replaced over time, which may mean additional surgery later on in life. Some patients might prefer to avoid having anything artificial in their body as well. Implant-based reconstruction is a definite second choice when radiation has been or will be done. Autogenous tissue reconstruction is where a patient's own tissue is used to reconstruct her breast. My preferred method of autogenous tissue reconstruction is the DIEP flap, which uses skin and fat from the lower abdomen to replace what was removed with the mastectomy. When the tissue is transferred from the abdomen to the chest, circulation must be reestablished to it in order for it to survive in the new location. This is accomplished by sewing small blood vessels that supply the circulation in the abdomen to small blood vessels in the chest. This process is technically demanding, and not all surgeons are trained in these techniques. As a microsurgeon, I have the expertise and experience to perform this surgery and do a large number of these procedures. The main advantage of the DIEP flap is that it gives the most natural result of all the different types of reconstruction. The skin and fat from the abdomen feels very much like the breast tissue that was removed, so the reconstructed breast feels more natural than an implant. It also looks the most natural because it can be shaped and adjusted to closely match what was removed. The DIEP flap procedure is a bigger operation than placing a tissue expander, with an average hospital stay of 3 to 4 nights and an average time off of work of 6 weeks. But since an implant isn't used, there wouldn't be as much chance of needing additional surgery to correct problems later. The DIEP flap is also an excellent option when a patient has had complications with implant-based reconstruction or is not happy with the result. Removing tissue from the abdomen does cause some pain and leaves a scar in this area, but it also allows patients to have excess tissue removed, similar to a tummy tuck, which may also be an advantage. In order to be a candidate for the DIEP flap, a patient would need to have some excess tissue in the abdomen. Some patients may be too thin to get back to their previous size, or may have so much in the abdomen that they end up larger. In most of these cases, options exist to get acceptable symmetry. The DIEP flap has replaced the tram flap in our practice. The tram flap didn't require microsurgical technique and expertise, but it removed one of the major muscles of the abdominal wall, resulting in more pain and weakness and a longer hospitalization and recovery period. Now you've seen the various options that are available to you here in St. Cloud. In addition to the skilled expertise of our surgical team, one service that many patients find helpful is the assistance of a patient care coordinator.
Hello, my name is Julie Sanner. I'm a registered nurse and the breast care coordinator for the Coburn Cancer Center. My role is to assist patients and their family navigate through the complexity of a journey with breast cancer. Upon learning of a new diagnosis of breast cancer, the information and decisions which need to be made can be very overwhelming. I act as a liaison between you and your specialized medical team. My central and unifying focus from diagnosis to survivorship is to make sure you and your family have all of the education, resources, and support available to help you make and manage informed decisions. Compassionate care, delivered respectfully, has always been central to the mission of the Coburn Cancer Center. St. Cloud is unique in its role as a center for the treatment of breast cancer. From the diagnosis through surgery for reconstruction and treatment of breast cancer, St. Cloud Hospital, Coburn Cancer Center, and Midsota work together in a coordinated approach to individualized care for each patient.
Thank you for watching today to learn about breast reconstruction options. I'd be happy to see you for a full consultation to discuss the options further and to come up with a plan that would be right for you.
I'm Vicki Sabanya. I'm from Royalton. 3 years ago, I was diagnosed with breast cancer. At that time, I had a mastectomy on the left side. And I thought I could go without a breast. I was going to be tough. Being tough made me depressed. And I talked to my cancer doctor and I told him that I needed to have I wanted a breast. I wanted to be a woman. And he suggested that I see Dr. Houle. So I went and seen Dr. Houle and he explained different options that we could do. And when I went in for my checkup, he come in and he said, "How are you doing?" And I said, "I am wonderful." And he looked at me and he says, "You're different." And I said, "Yes, I'm a woman." The cancer took away my breast. But when I met Dr. Houle, he gave me back my breast. And it wasn't something that was fake. It was me. It's okay, I won over cancer. Because it was all me.
My name is Michelle Funk, and I am one of Dr. Houle's patients for the DIEP flap. I come from a family who has a high history of breast cancer. My mastectomy and reconstruction was an elective procedure. My mother, my aunt, my grandmother all died of breast cancer, and I have a cousin my same age who has breast cancer currently. I was very satisfied with it. You cannot tell that I had the surgery. It looks like I had the breast lift, which a lot of women have after they have babies and stuff, and you cannot tell. Unless I tell you, you would never know. And my incision that I have on my abdomen looks like I had a tummy tuck done and is hidden by my jeans. Nobody knows that I have it unless I show them or tell somebody. Everybody has to make their own decision and make their own choices. The advice that, like when people ask me about it, the advice that I give is to make sure that you do what is correct for you.
Because of my mom having breast cancer and my younger sister having breast cancer, I opted to have bilateral mastectomy. And then I had the reconstruction, the DIEP flap reconstruction, and where they take the tissue. And I think, like I said, when you have good doctors and you have good people around you and a good support group, you can make it through anything. There's something that just says, you know what, I can do this. I'm not going to let cancer kick my butt. I'm going to kick cancer's butt before it even gets to me. Julie is a very good step to start out with because she really guides you in the path that you're going to want to take. And if it wasn't for her, I don't know where I would have started out. I don't know where I would have gone, because she's there and she's the calming effect, and she's the one who's saying, you know, this is what I'll do for you, and this is where we'll go, and this is when we're going to do it. And so she set up the appointment with the surgeon, and then she made sure that the surgeon and the doctor got together and set up the dates for the surgery. And so she really played a huge role. I'm so happy with my outcome, so pleased with it, and I had good people around me to guide me, to tell me what my options were, and not to tell me what to do, but to take my time and do what was right for me.
I did not need to have chemo or radiation. I did what's called an immediate reconstruction, so I had bilateral mastectomies and reconstruction done on the same day. Surgery took about 9 hours, and I was in the hospital 3 post-op days, and my recovery was a breeze. Make sure you check out all your options, because there's many different ways of having reconstructive surgery done, and you know, one shoe doesn't fit everybody, so make sure you get do check out all your options before making up your mind. Dr. Mallory did my mastectomies first, and while she's working on one side, Dr. Houle's starting to work on the other side already. So they work as a team together on opposite sides of the table. And then when Dr. Mallory is done, then Dr. Houle takes over and finishes.